Hello, I'm Priscilla. I'm a registered dental assistant. Today is my day off, and I have lots to do, but I have been asked to talk with you about infection control and dental health care practices. So if you would join me for the day, we can get started. Dental health care practices by nature come into contact with bacteria, diseases, viruses, and bodily fluids daily. Infection control is a set of standard precautions used for all patient care in order to prevent the spread of infection. Infection control is so important that the CDC and OSHA have created guidelines, rules, and consequences for the standards they have set. Let's begin by discussing each of the infection control standards. Hand hygiene. Hand hygiene is a simple yet effective way to prevent infections. Washing hands thoroughly and regularly before or after glove change is a simple but important step in practicing infection control. Next is personal protective equipment, or PPE. Refers to the protective clothing, helmets, gloves, face shields, goggles, face masks, respirators, or other equipment. These items are important because they were designed to protect the wearer from injury or the spread of infection and illness. Gloves are an important part of PPE. They provide a barrier between your skin and infection and have the potential to block transmission of contaminants from blood and bodily fluids. If you work or plan on working in a dental office, you will quickly learn the importance of sterilization, instrument processing, and biological monitoring. This will be an infection control standard you will practice daily. Dental instruments are used in patients' mouths every day. Some instruments are used sometimes more than once a day on different patients. So it is important to clean and sterilize the instruments properly between each patient use. The biological monitoring indicator will help you be sure the process is done correctly. Dental operatories serve as operatories to many patients throughout the day. It is important to sterilize and disinfect the operatory between and after each patient in order to prevent the spread of bacteria, disease, and cross-contamination. Disinfection is the process of eliminating or reducing harmful microorganisms from inanimate objects and surfaces. Sterilization is the process of killing all microorganisms. Let's move on to the importance of infection control and dental unit water lines. Water lines develop bacteria called biofilm. Contaminated dental unit water lines pose a risk of infection to the patient, particularly during surgical procedures by direct exposure of waterborne pathogens and to dental professionals due to inhalation of aerosols. It is important to clean them regularly and keep up with regular maintenance. The dental handpiece is the tool used to cut into teeth. CDC considers it a critical instrument because it penetrates sterile tissues or mucous membranes in the patients and requires heat sterilization. After a patient has been seen, there is much waste that needs to be handled. The Environmental Protection Agency (EPA) has authority, under RCRA, to regulate the handling, storage, treatment, transportation, and disposal of all waste types. All dental staff is required to abide by the rules or risk punishments and heavy fines. Upon cleanup, there is 3 different types of waste. Infectious waste or biohazard waste, which includes gauze soaked with blood and pulled teeth. There is contaminated waste like gauze used in the mouth, barriers, gloves. This is general waste and can be thrown in the regular trash. And then there is hazardous waste that is regulated, such as sharps and dental burrs. These are to be put in a regulated sharps container. By nature, dental offices pose many risks to all who enter, but with the right implementation of safety guidelines and standards, all who enter can feel safe and protected. Next time you're at a dental office, take a look around and think to yourself why infection control standards are so important, and hope that the workers there think it's important too. Thank you for joining me. I hope you learned a lot.